Welcome to this short video on the benefits of implementing a universal education procedure to better support pregnant and birthing survivors. We will discuss why universal education is more effective than routine screening questions, examples of how to communicate information and resources to your patients, and where you can find more information about supporting pregnant and birthing survivors. Domestic violence during pregnancy is much more common than many realize. As healthcare providers, universal education is one of the most effective ways we can support pregnant patients experiencing abuse. This video will guide you on how to approach this sensitive topic with compassion and care in a way that does not require a disclosure to receive resources and referrals. As a healthcare provider, you play an essential role in supporting survivors of domestic and sexual violence, even if you've never considered this before. And waiting for a patient to disclose isn't the most effective way to help. Universal education ensures that every person you see receives information and resources, whether or not they directly disclose to you. You've probably asked those 2 or 3 routine domestic and sexual violence screening questions hundreds of times. Yet chances are, very few patients have disclosed victimization to you. Part of you may even be a little relieved disclosures are so low. And that's a completely normal and common reaction. Talking about interpersonal violence can be very uncomfortable. It's normal to be concerned about how to respond or know what to do when a patient discloses. Experiencing interpersonal violence during the perinatal period is more common than many of us realize. Each year, an estimated 324,000 pregnant people in the U.S. are battered by their intimate partners. This means the chances of providing care to a pregnant survivor are actually quite high. Yet why are so many patients checking no on the screening question? The problem is in the screening itself. There are many reasons why a survivor may not disclose abuse. They may not be ready to talk about it. They may feel shame or embarrassment, or just not feel comfortable discussing something so personal with someone they just met. Sometimes providers themselves aren't comfortable asking the questions, may rush through them, or preface them with things like, "I'm sure this isn't the case for you, but," or "I'm so sorry to have to ask you these silly questions, but we're supposed to ask everyone." This may make a survivor feel like they can't disclose, or that they wouldn't be believed. Some survivors may wonder if they will be labeled as difficult or treated differently if disclosure is included in their medical chart. Still others may have disclosed in the past, but didn't receive help, weren't believed, or perhaps were even blamed for it happening. Whatever the reason, data shows us that violence often starts, becomes more severe, or becomes physical for the first time during pregnancy, which means the chances that a pregnant patient is experiencing interpersonal violence are higher than our routine screening questions would indicate. So what's a better alternative to asking those routine screening questions? The answer lies in universal education rather than individual screening. Universal education means that every patient, regardless of their circumstances, what they share with you, or what they disclose, is provided information on domestic and sexual violence. It's about creating an open, non-judgmental environment where resources are accessible to everyone and safety becomes a normal part of healthcare. Many survivors may never feel comfortable directly disclosing abuse. They may feel shame, be concerned about judgment, fear that they won't be believed, or have concerns about possible involvement of other systems, such as Child Protective Services. Universal education normalizes conversations about safety and reduces stigma. By offering resources to every patient, we can ensure that those who aren't ready to disclose still have access to critical resources. It plants a seed, letting them know that help is available when they're ready. Domestic violence affects millions of individuals each year, with pregnant people at a higher risk. Abuse during pregnancy can lead to serious health issues, such as preterm labor, low birth weight, and depression. Yet many maternal health patients may not be aware of these risks or where to seek help, and many healthcare providers may not know how to even start the conversation. Universal education normalizes the conversation and never requires a disclosure. When alone with your patient, you could hand them an informational pamphlet and start the conversation with something like, "I like to give this pamphlet to all of my patients. It provides some really good information on domestic and sexual violence and some examples of what healthy and safe relationships look and feel like. On the back, it has a phone number for a statewide hotline that is free and completely confidential. Even if you don't feel like you need this information, unhealthy and abusive relationships are so common that we all know someone who could benefit from reading it or using the resources." Although providing universal education doesn't depend on a patient disclosing, it is possible that a survivor may disclose abuse to you during the conversation. You don't have to be a trained domestic or sexual violence professional to provide excellent support to a patient that discloses abuse. At the same time, however, you will want to provide information and referrals to someone who is a trained expert on interpersonal violence. The most important thing you can do when receiving a disclosure is to believe them. Listen without judgment and without probing into personal and sensitive details. You could respond with something such as this: "I'm sorry that this happened or is happening to you. I'm not an expert in this, but I'm really glad that you told me. This is much more common than people realize, and other patients of mine have also shared this with me. I hope we can work together to make sure that you can access the support you need." You can direct them again to the resources and hotline number on the back of the pamphlet, and if possible, offer to let them call or text the number from a private space during your appointment. Experiencing domestic and sexual violence during or after pregnancy is much more common than direct patient disclosures indicate. By integrating universal education into your everyday practice, you ensure that every patient knows help is available, whether they directly disclose to you or not. Offering information and resources without waiting for a disclosure can save lives, reduce maternal health disparities, and increase positive birth outcomes for patients and their babies. For more information on domestic and sexual violence and implementing universal education, to access customizable examples of education and resource pamphlets, and to learn more about how to support pregnant and birthing survivors, please reach out to the Michigan Coalition to End Domestic and Sexual Violence. Thank you for taking the time to watch this short video on universal education. You can learn more about this and related topics at www.mcedsv.org. Click on the Maternal Health heading at the top of the page to access a wide variety of other recorded trainings, information on upcoming live trainings, and hundreds of other resources.